Hello everyone, it's Dr. Nirav Pandya. 49ers fans just found out that Ricky Pearsall will be undergoing season-ending surgery for his PCL injury that's been bothering him this training camp. Here's a quick breakdown of PCL injuries, what the treatment options are, and what the recovery timelines look like. Now, the PCL is one of the four main stabilizers of the knee. You have your ACL, your LCL, your MCL, and your PCL, which is located in the posterior part of the knee and connects the femur to the tibia. It prevents the tibia from shifting backward relative to the femur. This ligament is typically injured when there's a direct blow to the leg, such as when you fall or when you're in a car accident and your knee hits the dashboard. Now, PCL injuries are broadly broken down into three different types. You've got grade 1, which are microscopic tears, grade 2, which are partial tears, and grade 3, which are complete tears. Now, because the PCL has better blood supply, and if there isn't other larger injuries on a patient's MRI when they suffer a PCL injury, such as a meniscus tear, a cartilage tear, or injuries to other ligaments, the vast majority of these are first treated non-operatively. The thought is the PCL has better blood supply so it can heal, and there's more stability that can be achieved, unlike an ACL injury, with non-operative management. But there are a certain subset of patients who will undergo non-operative management who then subsequently have instability, pain, or swelling as they ramp up their activities. Then those patients will need to undergo surgery. There are basically two major surgeries that can be done. One is a PCL repair, where you can actually technically repair the PCL off of where it came off the bone, but that's typically done more in the acute setting right after the injury. The more common procedure is a PCL reconstruction, just like an ACL reconstruction where a piece of tissue is used from around the knee or potentially from a cadaver to make a new posterior cruciate ligament that's placed in the knee through drill holes. Now, the typical recovery for PCL reconstruction is between 9 to 12 months, very similar to an ACL reconstruction. And this goal, just like an ACL surgery, is to basically slowly get people back to mobility, improve their strength, and get them back to where they have a functioning knee where they can then perform at an elite level. Thank you.